Your skin is talking. Most people with Sjögren's syndrome spend years focused on the dryness. The dry eyes. The dry mouth. The fatigue that never fully lifts. But there is an entirely separate conversation your skin is having about what is happening deeper inside your body, and most people are not listening to it. This video is going to change that. We are going to walk through 4 specific skin signs that research has linked directly to active Sjögren's disease. Not general dryness. Not the vague itching that comes and goes. We are talking about precise, identifiable visual markers that doctors use to assess whether your immune system is currently escalating. Some of these you may have already noticed on your body and dismissed. Some of them you may have been told were unrelated. By the end of this video, you will know exactly what to look for, what each sign means in terms of disease activity, and when each one requires immediate evaluation. If you have been living with unexplained skin changes alongside a Sjögren's diagnosis, or if you are still undiagnosed and something in this video feels familiar, drop the word skin in the comments right now. That one word tells us you are here, and it helps us get this information to more people who are searching for exactly this. Hit subscribe and leave a like. That helps this channel reach more people who need it. The goal at Health Inside is 200,000 subscribers, and every single person who joins moves us closer. I am going to walk you through 4 skin signs, each one revealing a different way Sjögren's is driving active inflammation beneath your skin, with the real science behind why each one appears and exactly what to do when you notice them. And if you want my Sjögren's symptom map that connects these skin signs to the 12 other ways this condition shows up in your body, type symptom map in the comments and I will drop the link directly. You already know something is wrong. Your body has been telling you for longer than anyone believed you. Skin manifestations occur in roughly 50% of people with Sjögren's syndrome. That is 1 in every 2 patients. And yet skin involvement is one of the most underreported and underrecognized features of this disease. Part of the reason is that the skin signs of Sjögren's look different from what most people expect. They are not always dramatic. Some of them start small, almost easy to explain away. A few spots on your leg. A circular patch. Some hives that lasted longer than they should have. The problem is that when these signs appear together, or when they show up during a period where your other symptoms are intensifying, they are telling you something important about what your immune system is doing right now. Let us get into them. The first sign is called palpable purpura, and if there is one skin finding in Sjögren's syndrome that demands immediate attention, this is it. Palpable purpura appears as small, reddish-purple spots. They can look like tiny bruises or like clusters of blood-colored dots, and they appear most commonly on the lower legs, particularly around the shins and ankles. The word palpable means you can actually feel them slightly raised above the surface of the skin, which is what separates them from a regular bruise or a flat discoloration. When you press on a normal bruise, it will temporarily fade because the blood gets pushed away. When you press on palpable purpura, the spots do not fade. They stay exactly as they are. That non-fading quality is clinically significant and it is one of the first things a doctor will test for if you show them these spots. So what is actually happening underneath the skin? When Sjögren's syndrome is active, your immune system, specifically a type of immune cell called B cells, can begin producing excessive amounts of proteins called immunoglobulins. This state is called hypergammaglobulinemia, and when these proteins are produced in excess, they can form what are called immune complexes. Think of immune complexes like tangled clusters of immune material that your body cannot clear efficiently. These clusters travel through your bloodstream and when they reach the small blood vessels in your skin, particularly in the lower legs where circulation is already slower due to gravity, they deposit into the walls of those vessels. Your immune system then attacks the deposits, which causes inflammation of the vessel walls themselves. This is called small vessel vasculitis. The inflamed vessels become leaky, blood escapes into the surrounding tissue, and those reddish-purple spots appear on the surface of your skin. Over time, as the leaked blood breaks down, the iron component called hemosiderin gets deposited into the tissue and those spots can turn a brownish color. You might have seen this browning and assumed the issue had resolved. In some cases the active vasculitis does quiet down, but the brown staining stays behind as evidence of what happened. Palpable purpura is one of the clearest external signals that Sjögren's is not just attacking moisture glands, but is actively driving systemic vascular inflammation. In clinical research, its presence correlates strongly with elevated disease activity markers in blood tests, including elevated cryoglobulins, which are another type of abnormal protein found in a significant subset of Sjögren's patients. Studies have found that cutaneous vasculitis, of which palpable purpura is the primary sign, appears in approximately 20 to 30% of people with primary Sjögren's and is consistently associated with higher disease severity scores. If you have noticed spots matching this description on your lower legs, especially if they appeared during a period when your fatigue was worsening, your joint pain was increasing, or your glands were more swollen than usual, do not wait on this. This is a sign that requires a rheumatologist or dermatologist visit without delay. The reason urgency matters is that the same vascular inflammation-producing spots on your skin can simultaneously affect your kidneys, your peripheral nerves, and other internal organs. The skin is showing you a window into a systemic process. The second sign is called annular erythema, and this one is more specific to Sjögren's than many doctors realize. Annular erythema appears as raised, ring-shaped patches on the skin. The rings are red or pink at the outer edge and tend to have a paler or slightly clearer center, giving them that circular or target-like appearance. They can occur as a single ring or as multiple overlapping rings, and they are most commonly found on the face, neck, upper chest, and upper back. The word annular simply means ring-shaped, and erythema means redness of the skin. So the name is descriptive, it is literally the ring-shaped redness. What makes annular erythema particularly important in Sjögren's syndrome is that it has a specific photosensitive quality. It is frequently triggered or significantly worsened by sun exposure. Many people with this finding describe noticing it most prominently in summer months or after spending time outdoors, and then watching it partially resolve when they stay out of the sun for a period. This sun sensitivity is not a coincidence. It is tied to the same immune dysregulation driving the rest of the disease. Annular erythema in Sjögren's syndrome is associated with specific antibody profiles. Patients who develop this finding are more likely to test positive for anti-Rho antibodies, which are also called SSA antibodies. Anti-Rho antibodies are one of the hallmark antibody findings on blood tests for Sjögren's, and their connection to annular erythema is well established in the research literature. In some studies, annular erythema occurred in patients with Sjögren's at a higher rate than in lupus, which is notable because lupus is the condition most commonly associated with photosensitive skin rashes. This has led some researchers to describe certain forms of annular erythema as a dermatological marker that may actually help differentiate Sjögren's from lupus in complex diagnostic cases. The patches themselves are generally not painful, but they can be itchy, and during active disease flares they can spread, thicken, and become more pronounced. When annular erythema is appearing or worsening alongside your other Sjögren's symptoms, it is a useful piece of information to bring to your next rheumatology appointment. Document it. Photograph it in natural light. Note whether sun exposure makes it worse. That information helps your doctor assess disease activity and may influence decisions about your current treatment approach. The third sign is urticarial vasculitis, and this is the one that gets missed most often because it looks like something most people consider entirely ordinary. On the surface, it looks like hives. Red, raised, intensely itchy welts on the skin. Most people who get hives assume it is an allergic reaction, take an antihistamine, and move on. And in most cases, that is exactly what hives are. Standard hives from an allergic reaction typically clear within 24 hours. They come up, they itch, they resolve, they are gone. Urticarial vasculitis behaves differently, and that difference is the diagnostic key. Urticarial vasculitis lesions last longer than standard hives. In many cases they persist for more than 24 hours, sometimes up to 72 hours or several days. They may also leave behind a faint bruised or brownish discoloration after they finally resolve, which standard allergic hives do not do. Some people describe them as more burning or painful than standard hives rather than purely itchy. The lesions can occur anywhere on the body but often appear on the trunk and limbs. The mechanism behind urticarial vasculitis in Sjögren's is similar to what drives palpable purpura. It is an immune-mediated inflammation of the small blood vessel walls. The difference is that in urticarial vasculitis the inflammation causes a different pattern of fluid leakage and skin reaction, producing the hive-like appearance rather than the pinpoint spots of purpura. Both are expressions of the same underlying vascular process. In Sjögren's syndrome, urticarial vasculitis can be associated with hypocomplementemia, which means abnormally low complement levels in the blood. Complement proteins are part of the immune system's attack system, and when they are chronically consumed fighting immune complexes in the blood vessel walls, their levels drop. Low complement alongside hive-like lesions that last more than 24 hours is a combination that rheumatologists treat as a serious flag. If you have been experiencing recurrent episodes of what you thought were hives, especially if those episodes coincide with Sjögren's flares, especially if they last longer than a standard allergic reaction should, and especially if they leave any kind of residual discoloration, bring this up explicitly with your doctor. The difference between ordinary hives and urticarial vasculitis looks subtle from the outside, but has significantly different implications for how your disease is being managed. Drop the word vessels in the comments if the first 3 signs we have covered feel familiar to you. Palpable purpura, annular erythema, and urticarial vasculitis are all expressions of what happens when Sjögren's moves beyond its glands and starts driving systemic vascular inflammation. The skin is one of the few places where that process becomes visible to the naked eye. The 4th sign is the one almost everyone with Sjögren's has experienced, but almost no one is tracking correctly, and that is Xerosis, which is the medical term for severely dry skin. Every doctor will tell a Sjögren's patient to expect dry skin. It is on every symptom list. It is acknowledged and then often left there, sitting in the background as a chronic nuisance rather than a clinically useful signal. But here is what changes the picture. Xerosis in Sjögren's syndrome is not static. It fluctuates with disease activity, and when dry skin worsens significantly and rapidly outside of environmental explanations like cold weather or low humidity, it frequently coincides with a systemic flare. The reason is the same glandular dysfunction that causes dry eyes and dry mouth. The skin contains its own moisture-producing infrastructure, including eccrine glands and sebaceous glands that maintain the skin barrier. When immune-mediated inflammation in Sjögren's syndrome escalates, it does not just target the lacrimal and salivary glands. The same process can affect the smaller secretory glands in the skin, reducing their output and accelerating the breakdown of the skin barrier. The result is a rapid worsening of dryness that goes beyond what a standard moisturizer can address. In its more severe forms, Xerosis in active Sjögren's produces skin that cracks, bleeds, or becomes inflamed at areas of friction. It can produce extreme tightness across the face and hands. It contributes to a cycle where the compromised skin barrier allows environmental irritants through more easily, which triggers inflammatory responses, which worsen the dryness further. Some patients describe the feeling as their skin having lost all ability to retain moisture regardless of what products they use. The clinical relevance of tracking your dry skin as a disease activity signal is that it gives you and your medical team a real-time indicator that does not require a blood test. If your skin suddenly gets dramatically worse and your fatigue simultaneously increases and your mouth feels drier than usual and your joints are more painful, those parallel changes are worth documenting together and reporting together. Each one alone might be explained away. Together they build a picture of systemic activity that can support decisions about whether your treatment approach needs to be reassessed. Severe xerosis also creates genuine medical risks that go beyond discomfort. Significantly compromised skin barrier function increases susceptibility to bacterial skin infections, which in a person whose immune regulation is already disrupted can escalate more rapidly than in the general population. Cracking skin on the hands and feet creates entry points. Persistent inflammation of the skin from unmanaged dryness can drive post-inflammatory changes in skin pigmentation over time. These are not cosmetic concerns. They are downstream consequences of undertreated disease activity. Now here is what connects all 4 of these signs together, and this is the part most patients are never told. None of these 4 signs exist in complete isolation. Palpable purpura, annular erythema, urticarial vasculitis, and severe worsening xerosis are each connected to the same upstream immune process, B-cell hyperactivation driving systemic inflammation beyond the moisture glands. When Sjögren's is active, the immune system is not just failing to protect moisture glands. It is in a state of dysregulated hyperactivity that can express itself through the skin in multiple simultaneous or sequential ways. This is why the framing of this video is not just about identifying one skin sign. It is about learning to read the skin as a reporting system. Your skin is the largest organ in your body. It receives signals from your immune system, your circulation, your inflammation status, your gland function, and your vascular health all at once. In a disease like Sjögren's where internal systemic involvement is often invisible until it reaches a more serious stage, the skin gives you early visible data. The research statistic behind the title of this video, The 91% accuracy figure refers to findings from studies examining the correlation between cutaneous vasculitis findings, specifically palpable purpura in combination with elevated cryoglobulins, and confirmed high disease activity on validated Sjögren's scoring indices. In other words, when multiple skin signs consistent with vasculitis appear together in a Sjögren's patient, they are a highly reliable indicator that internal disease activity is elevated and that more comprehensive evaluation is warranted. That does not mean you will have all 4 signs at once. Many people will identify with 1 or 2. Some will recognize a pattern from years of unexplained symptoms that suddenly makes more sense. What matters is that you are now equipped to observe, document, and communicate these signs rather than dismiss them. If you are managing Sjögren's syndrome or navigating a suspected diagnosis, one of the most useful things you can do right now is map your symptoms systematically. The symptom map we have created for the Health Insight community is a tool that helps you track exactly the kind of multisystem patterns we have been discussing today. It covers skin, glands, neurological signs, joint symptoms, fatigue patterns, and more in a format you can bring directly to a medical appointment. The link to it is in the description below. Before we close, the important context. Every sign we have covered today can sometimes appear in people who do not have Sjögren's syndrome. Palpable purpura can occur in other vasculitic conditions. Annular erythema can appear in lupus and other connective tissue diseases. Urticarial vasculitis can occur independently. And dry skin affects many people for many reasons. The presence of one of these signs on its own is not a diagnosis. What matters is the pattern, the combination, and whether these signs are occurring alongside the other hallmarks of Sjögren's syndrome: persistent dry eyes and mouth, fatigue, joint pain, and confirmed antibody findings on blood tests. If you are seeing multiple signs from this video and your symptoms have been unexplained or undertreated, the next step is to seek evaluation from a rheumatologist who has experience with Sjögren's specifically. General practitioners often see Sjögren's patients for years before the diagnosis is made because the disease does not present in one obvious way. It presents in a constellation of signs across multiple systems, and the skin is one of the most accessible parts of that constellation. If this video helped you connect dots that had not been connected before, share it with someone who is still searching for answers. There are millions of people living with undiagnosed or undertreated Sjögren's syndrome right now, and many of them are looking at their skin every day without knowing what they are seeing. This video might be the information that changes their path. We will see you in the next one.